Throughout the last year, collecting race-based and the income level data has become very key in tracking COVID-19. It's pointed us to those vulnerable communities. And now that the vaccine is starting to be rolled out, that information is going to be key once again.
It's rather damning when you're thinking, here's an opportunity to save lives out there immediately, and we're still seeing this systemic discrimination take hold.
The communities and people hardest hit by COVID-19 could be at risk of falling behind in getting vaccinated, according to some in the medical community. It took months at the outset of the pandemic before race-based data and mapping positive COVID cases helped determine hotspots in Toronto. Now it's needed again.
We're seeing a complete mismatch with where there's a supply of the vaccine in the neighborhoods that are hardest hit versus as to where the actual take-up is taking place. And we're seeing that again across a social gradient or social gradient map of the city.
The city has said that community outreach was going to be a part of its vaccine rollout plan, with mobile clinics and so-called neighborhood ambassadors, for example. There's no indication how data will be used to decide which communities are prioritized, though, other than acknowledgement that it would be useful.
There would be great value in using those same kind of data to inform our vaccination efforts to ensure that we're providing as equitable an approach as is possible as we seek to vaccinate the entire population.
The province is said to be collecting race-based and income data from those being vaccinated on a voluntary basis. Toronto's Board of Health has asked that the information be made publicly available. That hasn't happened yet, and those serving the community say it's needed to see who is and isn't getting their shot.
With the vaccination strategy, again, there's an opportunity to take a look at that data again. So to make sure that vaccination clinics are collecting race, ethnicity, language, and income data, and really matching that up.
If only to make sure those still testing positive for COVID-19 have access to vaccines sooner rather than later. Now, according to Toronto Public Health, 21% of positive and probable COVID-19 cases for most part of last year, from the end of May until the end of December, the race-based and socio-demographic data wasn't actually collected.